The next stretch here is very important for the cervical spine and upper thoracic spine. It's called the chin tuck. It helps restore the cervical curve. It also is very important for cervical herniated discs or cervical whiplash injuries. Once again, it's important to do it right in having the posture set the way that it should be.
So again, this is one that's very, very effective, especially to restore the curve, like Dr. Neal said. But a lot of people are doing this incorrectly, so we're going to demonstrate the proper technique. What you're going to do is, I actually prefer this one to do this one standing. And
against the wall, right.
If you do this against the wall, you can actually put a pillow here and get a little bit more range of motion. But again, you can do it standing, sitting, whatever. So it's actually a really simple movement. You're actually just going to take your chin and tuck it straight back. And so go ahead, the motion's going to actually look, I'll actually demonstrate too, straight back like this. And then you're going to use your fingers to give it a little overpressure. And then
you
you're
could
going to
do
relax.
this sitting at a computer. This is the kind of thing you could do at any time of the day.
And one thing that a lot of people make this mistake, which Jane is actually making here, is they're tucking their head down. What you actually want to do is your line of drive, you want that to be straight back, just like you're pushing your chin into your the back of your throat. And another mistake people make is they use the pushing motion. So what you want to do is you want to actually get your active range of motion, which is basically what you can do first. So you're going to tuck as far as you can first, and then you're going to bring your arms up, and this is the passive range of motion. So you're going to give a little bit of overpressure and then relax. And I prefer doing the active motion with my hands at my side so that my spine is all lined up. So go ahead, give it a shot. So she's going straight back. Now she's going to bring up her hands for just a little bit of overpressure and relax. And one other mistake I see people make is when they go into the relax part, they'll come here, do this, overpressure, and then they'll relax, like exaggerate the relax.
Keep your posture on that.
Yeah, you just want to literally just relax. The motion's going to be a really small motion, but what it'll do is actually for people who have a straight curve in their spine, it's going to restore the curve.
As I was talking about before with frequency of doing it, it's the kind of thing you really can do at the computer. Dr. Jean, how many times, what do you tell your patients on it?
So the chin tuck is a little bit different than any other stretch that we showed. What I tell almost all my patients is you actually want to do this about every 2 hours when you're first starting. And don't get too caught up into how many reps or anything. Just, every couple hours, do 10 or so. You don't even have to count, just a little bit here and there. And you're going to actually feel in the first couple of days, you're going to feel 4 tiny little muscles. It's almost going to feel like if you haven't worked out in a while and you just start working out, you're going to feel 4 little muscles in your neck. It's almost going to feel like they're weak from working out. So after a couple of days, some of that weakness and soreness will sort of fizzle out.
Because you're strengthening those small muscles.
Right, and that's how you know now you can start backing off every couple hours. Everyone's a little different. It might take 2 days, it might take a week, but just in the beginning, every couple hours, just be really good about getting this in, and then you can start backing off. And this is actually something that you can do throughout life, even once or twice a day. If you're doing something hard, standing in line at the grocery store, just standing there, you can get a couple of chin tucks in.